Well, hello everyone, and let me add my welcome and thank you to Jill and thank you to Sarah. I am super excited to be here. This is an incredible venue. I'm with Acxiom Corporation, which is a global data processing company. So I want to talk to you today about respecting the data and the ethical use of data. William James was credited with having invented psychology. He taught the very first psychology course in the US at Harvard. And William James famously said, people tend to become what they think about themselves. So does society. Society becomes what it thinks about itself in the form of our human values, our social norms. Collectively, we arrive at what we believe is legal, just, and fair. So society is becoming what they think about data-driven health in the form of its uptake of biobands, sensor-embedded shirts, sensor-embedded shoes. One of my personal favorites, Proteus's sensor-embedded med that transmits to a Bluetooth-enabled patch, which you wear with a gyroscope that measures uptake and efficacy of the med. So there's all this powerful good and convenience and value to our lives and our health and our well-being that is being derived as society becomes what it thinks about data-driven health. Yet there is a very sinister, potentially quite bad side to this story, and that is with the misuse of data, all this vast sensor-embedded data that we are enabling today, and its misuse that can result from a purposeful bad actor and a bad act, or inadvertent bad acts or bad actors. I want to talk to you just a moment about trust. Trust is the foundation of every human relationship. It's my foundation of my relationship with my best friend. It's you with your spouse, with your boss, with the brands we choose to use, with my health apps on my phone, with the sensor-embedded shirt that I have. If I have trust, and trust is very, very sticky. If there is trust, you have longevity, you have loyalty, you have affinity. And if there's not trust, things go very slow. I may not engage an app or a brand. If I trust you and you make a mistake, I'll probably give you a chance to explain and make it right. But if I don't trust you, I'm hesitant, I may not engage at all. I may avoid you. So trust. And how do we achieve trust? We achieve it with ethics, with ethical behavior. And in the world of data, where we're moving into data-driven everything, it is the ethical use of data that's going to enable the trust, create affinity, loyalty, longevity for all the marvelous innovation that we want as a society. We're becoming data-driven health because it will coincide with our social norms and our human values. Now, we have some history here, and at Acxiom, of course, we're a mature technology company in the business for 45 years. And we've served all the major industries, so we know what data exists, what data they have, what data they don't have, what data they want to have, how they use data. And we are taking them into the digital future at an amazing rate and well ahead of any contemplated law, rule, or reg. And where we've been, and this is very important to know where you've been and recognize where you're going, historically the data has been actively collected, right? Please fill out this form. May I have your name and telephone number? So the collections are active and there's a form of consent. I know the collection's happening and I am complicit, I'm agreeing, right? So that is implied consent for the use or purpose. Most of that data, almost all of it, has been personally identifiable. And in the health space, of course, it's personally identifiable health information, or PHI. Or we rolled it up into a bundle and we made it aggregate. The work done on the data historically has been batch enabled. Again, another very active practice. I'm batching up this data, I'm going to send you a batch, I'm going to FTP a file. And where we are today is very different. We are in massive data streams, velocity, variety, volume, with massive analytics. But most importantly, the different world that we live in with our health apps and our shirts and our shoes and our cars is that this is observational data. It is passively collected, it is passively shared, it is passively acted on by massive algorithmic formulas and learning algorithmic formulas. This is a really, really big change. What it's done is it's brought forward new harms, and it also informs new sensitivities. We come from a world where sensitive data was my personal health information, my detailed financial data, my personally identifiable information about my children, and we're living in a world where my geolocation over time can become very sensitive. If you take the gyroscope that is informed by my sensor-embedded med, and you take my place and time data from my smart device, and you combine the two, and on Monday, Wednesday, and Friday at a geolocation right across from my office that happens to be a hotel, which may be okay, but my gyroscope is informing some activity that typically doesn't happen in a workday, right? So place and time data can become very sensitive. So there's a lot of evolution going on in the marketplace, and this presents some big challenges for all of us. Now, where are we? We are accelerating into data-driven health, the most sensitive part of our lives. If we do this well, our lives are improved, our health and well-being are improved, and if we do it wrong, it's not, it's harmed. If you think about all the signals flying off from the patient journey, we're looking or moving towards ubiquity. You wouldn't think about it, but it is. There's digital identity that goes to me and my patient journey or my health journey. You have cookie IDs, mobile IDs, my global patient ID. You have my behavior. My very behavior becomes a fingerprint and a form of identity. And then you have lots and lots of innovative, futuristic means of identifying or resolving to an entity that informs my patient journey. You have the place and time data, which is valuable and powerful. It indicates my point of interest and a point of relevance. And at some point, we are going to achieve placefulness, wherein I arrive in a place, my sensors are read, I send a signal, I receive a signal, it's algorithmically acted on, and I get placefulness. I arrive in a place, and the place is optimized for my well-being and my health and my convenience. All of the sensor data is passively generated, passively collected, passively shared. And it enables some really wonderful unanticipated uses. Like, we can't think of them all today, but the data's powerful and the potential good new uses are powerful. But we still have this extreme friction of the misuse and the dangers. And they are things like social damage, reputational harms, physical harm, health outcomes that are degraded or wrong or life-threatening or life-ending, financial harm. You have enforcement. If you get any of these things wrong, you could be popped for deception or unfairness. And we have what I worry about. We're going to innovate in a way that supersedes, bypasses, ignores our human values and our social norms. We're going to innovate in a way that doesn't accommodate collectively what we believe is legal, just, and fair. We have something called, you'll hear it called by a few different names, algorithmic determinism, or algorithmic discrimination or digital determinism. The FTC released their paper yesterday. Has anybody read that? The new big data report? And they talk about disparate impact, and that this is the thing that all brands that are innovating in the digital space must watch out for. And in the healthcare space in particular, where we have a convergence of HIPAA regulated and non-HIPAA regulated, again, moving towards that ubiquity, just the sheer will of the marketplace and our societal uptake of all of the apps and the devices, we can supersede in a way that does create that algorithmic discrimination, that disparate impact, that you'll get popped for deception or unfairness, or the worst thing of all, you'll break the trust, either in your brand, your service, your product, or the entire ecosystem. So this is a time for care. And I want to introduce what I believe is the way forward. And this is this idea of how do you build trust, protect trust, ensure trust. How do you operationalize ethics? You do it on the front end. You do it at ideation, at design, and at the engineering level. This is a deliberate method that an enterprise would undertake, where you characterize the project. You articulate and document the purpose, the sources of data, all of it, the sensor data, the IDs, the behavioral fingerprints. You understand the provenance of the data, the permission on the data. You move to the preparation of the data, the accuracy of the data. You identify the insights that you can achieve, that you intend to achieve. You understand what accountability surrounds the project, the service, the product. And you identify the stakeholders, which includes the patient or the consumer as well as the brand. You do a benefits risk analysis. You enable the benefit and you mitigate the risk. And you have a deliberate thought process and a documented effort to do that. You identify the outcomes that you're wanting to achieve. You ensure that the insights are sustainable and the quality is sustainable. And then, based on all of the documented facts, you apply judgment. And this is the collective, is it legal? Is it just? Is it the right thing to do? And is it fair? How do we feel about this? Is it the right thing to do? Then you do the fairness test. Is it respectful? And then is it fair? I want to leave you with 7 thoughts. The ethical use of data to unlock the possible, the way to move forward with rapid innovation. 7 values that could mean the difference between the success or the failure of your brand, of your product, of your service, of your innovative new idea. Number 1, when you apply or operationalize this ethical use of data, it gives you the confidence to move forward with these massive streams of data. It takes away the worry and the what ifs. Number 2, it is a deliberate method that results in good outcomes for your brand and for the patient. You arrive at what is legal, at what is just, and what is fair. Number 3, it is a more mature organizational, information governance approach. Number 4, it addresses the complexity and the nuance, and it uncovers the data quality issues and the algorithmic problems, which are super white hot right now with every regulatory entity, all the consumer advocates, and the media. This disparate impact, this algorithmic determinism. Number 5, it's the pathway to compliant data use in other regions. It's going to help you get into other countries. Number 6, as data governance increasingly becomes a competitive differentiator, applying a contextual ethical interrogation, or the ethical use of data, this mature governance approach to data enablement. It is a competitive differentiator, and it goes to your brand trust and your brand loyalty. And then number 7, in a world with increasing legal uncertainty, more data breaches, more privacy incidents, this is a system and an approach that allows you to identify and document the facts, and then when you get an interrogation or an enforcement action, you'll have the answers, you'll be able to show your deliberation, and you'll be able to answer the questions. Thank you very much for having me today. I really appreciate it. Have a good conference.